HighBridge, a division of Recorded Books, presents Righteous Rebels, Revised Edition, AIDS Healthcare Foundation's Crusade to Change the World, by Patrick Range McDonald. Read by Paul Boehmer. Part 1. A New Year of Fighting for What's Right. Chapter 1. A Textbook for Righteous Rebels. For as long as I can remember, I have been drawn to a certain type of rebel. The one who catches my eye and gives me inspiration tends to be modest and thoughtful and selfless to some degree. He or she eschews fads and common wisdom and, instead, lives by a deep sense of what's right and just, even if that means being at odds with large swaths of the population, which happens often. He or she is smart, but not overly intellectual or academic. That would prevent that person from seeing certain realities and then going about challenging them. But perhaps the overriding trait of this individual is an all-consuming desire, maybe even an obsession, to live a life that's true. This righteous rebel fears selling him or herself out. Sometime in the winter of 1998, in Los Angeles, I met Michael Weinstein, the co-founder and president of AIDS Healthcare Foundation. I had just moved to L.A. from New York City, and I was working as a reporter at the Los Angeles Independent, a community newspaper chain. Mickey Jackson, a close friend of Weinstein's and a community activist whom I often talked with, introduced us at a civic event. Weinstein had been leading AHF since its foundation in 1987. He was trim and fit, sharp-featured, and 46 years old. He wore a dark suit and tie with his black hair slicked back. He looked like a Wall Street hotshot, not the president of an HIV/AIDS nonprofit. We only talked briefly, but Weinstein came across as smart and quick-witted, with touches of modesty and shyness. He also exuded a palpable energy that I associated with my favorite kind of New Yorker. I later learned he was born in Brooklyn. After our conversation, I decided to keep an eye on Weinstein and AHF. Every now and then I wrote a story about the organization. But it wasn't until January 25th, 2000, that Weinstein popped up on my radar in a singular way. I'd picked up the Los Angeles Times that morning and read, with some confusion, that he was being vilified for advocating for condoms. Even more baffling was that the controversy was taking place in West Hollywood, a small city wedged between Beverly Hills and Los Angeles and considered one of the world's gay meccas. Weinstein was Jewish, gay, and a long-time AIDS activist, but someone had gone to several gay bars in West Hollywood and put up wildly inappropriate posters that deemed him a condom Nazi. The poster claimed that he was an enemy of the gay community who had betrayed us, and he was compared to such anti-gay demagogues as Senator Jesse Helms and Jerry Falwell, co-founder of the Moral Majority, a conservative Christian political group. Weinstein's sin, I learned from the article, was that AHF had pushed for an HIV prevention program in which nearly all West Hollywood bars and nightclubs, gay and straight, would be mandated by the city to offer free condoms and safer sex literature to customers. Bar and nightclub owners, however, wouldn't pay a cent. The charged rhetoric aimed at Weinstein wasn't the only puzzling thing. For decades, West Hollywood had been a popular red light district, where straight and gay people patronized the area's many bars and nightclubs. They partied hard and hooked up. But people who were drunk or high were less likely to practice safer sex and were more likely to contract and spread sexually transmitted diseases. In the age of AIDS, which had killed more people in 1999 than in any previous year, a bowl of free condoms at a West Hollywood bar seemed sensible, if not obligatory. In addition, West Hollywood's gay residents had been rocked by the deadly AIDS epidemic. In fact, in 2000, the city, which had only 35,874 residents and less than 0.5% of Los Angeles County's population, had a whopping 7% of the county's HIV/AIDS cases. Local public health officials estimated that between 30 and 40,000 adults, 18 to 64 years old, in L.A. County were infected with HIV/AIDS. That meant between 2,100 and 2,800 West Hollywood residents were living with HIV. That alarming statistic didn't tell the whole story. Most, if not all, of the HIV/AIDS cases in West Hollywood involved men who had sex with men. City officials believed that roughly 1/3 of West Hollywood's total population, or 11,838 people, was gay adults. The overwhelming majority were men. Few lesbians lived in the city then. If 2,800 people had HIV/AIDS in West Hollywood, that meant a potentially devastating 24% of the city's gay and bisexual male population was HIV positive. With those kinds of numbers, one would think that West Hollywood's community leaders, including politicians and bar and nightclub owners, would do anything to help protect people and lower the city's outrageous infection rate. Instead, they aggressively opposed the free condom program, particularly gay bar owners who were probably behind the condom Nazi posters. They believed that condoms and pamphlets would offend customers and drive them away. A perceived threat to profits, rather than a public health epidemic, was their chief concern. In the months that followed the condom Nazi episode, Weinstein and AHF continued to stand up and take the heat. The West Hollywood City Council was another story. Under heavy political pressure from bar owners, the council passed a watered-down voluntary condom program. The so-called compromise was far less sweeping, and the rollout would be problematic. In response, AHF pushed for a ballot measure so voters could override the city council and approve the organization's more effective proposal. But that failed in 2001. West Hollywood residents voted no by 53%. There is an underlying prudishness that came out of this, Weinstein told the Los Angeles Times after AHF's defeat. A lot felt the government shouldn't play a role and business shouldn't be required to play a role in condom distribution, that it's a matter of personal responsibility. Regardless of the outcome, Weinstein struck me as gutsy and principled, and I admired his outspoken, tenacious style. He not only clashed with bar owners and politicians to implement policies that protected the public's health, but also with other activists and organizations within the AIDS movement, if necessary. Many years after the West Hollywood condom battle, Peter Staley, a well-known AIDS activist, told Slate magazine, "If there's one thing that every AIDS activist knows, it's that Michael Weinstein is not an AIDS activist. Yes, he's the CEO of the largest AIDS organization in the country, based on revenue, but from the get-go his tactic for building his empire has been taking contrarian positions that assure his placement in almost any article that appears about the latest HIV/AIDS debate. Sean Straub, a longtime AIDS activist and founder of Pause magazine, told me via an email interview, "It is like AHF and Weinstein start from the position of figuring out how many people they can piss off rather than finding allies or finding where they share ground with others." Those criticisms were typical of what I had heard about Weinstein, but they never rang true to me. By 2007, I was a staff writer for LA Weekly, one of the top alternative newspapers in the United States. When I wrote about gay rights or gay men's health issues, I often contacted Weinstein. He had a different way of seeing things, and he could be counted on for thoughtful, if not provocative ideas that needed saying, but that few others had the courage to say. After California voters passed Proposition 8 on November 4, 2008, I interviewed Weinstein. The ballot measure, which was later declared unconstitutional, had taken away the existing right of same-sex couples to marry in California. Numerous gay rights groups had run the No on Prop 8 campaign to keep same-sex marriage legal, but many political observers believed they'd done a disastrous job. Few gay leaders, however, were publicly critical. Just coming off a shocking loss, they didn't believe the time was right for a thorough dissection of the No on Prop 8 campaign. Weinstein wasn't so hesitant. "When is the time to finger point?" Weinstein said to me for an article. "After we lose again? Look at what the Republicans are doing. After Obama's victory, they're sizing everyone up." Weinstein urged younger gay rights activists to hold No on Prop 8 leaders accountable. "It's important for people to tell the truth," he said, "and it's important for the young generation to demand the truth." For a 2012 LA Weekly story about gay men's health, I asked Weinstein about a popular theory among academics called the minority stress model. It essentially pushed the idea that the stress of living with discrimination and homophobia caused serious health problems among gay men. Gay rights leaders and health experts then employed the theory to explain why gay men used drugs and alcohol more than straight men, suffered depression at higher rates than straight men, and engaged in risky sexual behavior that resulted in high rates of HIV and STD infections. Weinstein thought the minority stress model was a cop-out. "All the sociological factors are just an explanation after the fact," Weinstein told me then. "It's an excuse. It may even be a valid one, but it's still an excuse." His remark flew in the face of the victimhood politics pushed by many gay researchers and activists, and it challenged gay men to honestly look at their own behavior rather than blame others for their health issues. In fact, a sociology professor I also interviewed for the article made a strong case for a concept called reference group theory, in which an individual's close friends and associates set the standard for what is acceptable behavior, and then that person follows suit. For example, if a gay individual is surrounded by people who engage in risky sexual behavior, that person is more likely to engage in risky sex. On the flip side, if one's friends always practice safer sex, a person is more likely to do the same. The stress of living with homophobia, according to the professor, didn't have as much impact on gay men's health and behavior as did their friends. Too often, though, gay leaders refused to publicly confront the messy issues that affected the health of gay men. After decades of persecution, they reasoned, they didn't want to give homophobes any ammunition to demean the LGBTQ+ community and stop the gay rights movement. It was a public relations strategy that Weinstein wanted no part of. He once told me that saving lives rather than saving face was what mattered most, and you couldn't save lives without talking honestly and openly. As time went on, I came to know more of AHF's story, the nut of which was mind-boggling and profound. It was also largely untold. The Los Angeles press, except for a reporter or two, seemed unable to grasp that the organization was a hometown success story on a global scale. In 1987, AHF started with only one full-time employee, had very little money in the bank, and provided hospice care to terminally ill AIDS patients in the Los Angeles area. A few decades later, everything had changed. AHF had turned into the largest HIV/AIDS medical care provider in the world. It had not only saved millions of lives, but also served many of the most vulnerable people on the planet: women, children, the poor, gay men, people of color, transgender people, and intravenous drug users. By 2013, AHF worked in 32 countries, including the U.S., Russia, Ukraine, China, India, Cambodia, South Africa, Nigeria, Mexico, Haiti, and Argentina. Provided life-saving HIV drugs and medical services to more than 276,000 registered clients, and operated with an $857 million budget and 1,906 staffers. Additionally, in 2013, AHF had performed nearly 2 million free HIV tests around the globe, including 129,326 tests in the United States, identified 72,584 people who were HIV positive, and distributed nearly 34 million free condoms worldwide. These were big, bold contributions to the global AIDS fight that no other organization had come close to duplicating. In my mind, someone had to write a book about this, so I approached Weinstein with the idea of a book. He was interested, but said early on that he didn't want the focus solely on him. He also wanted an honest book, which was exactly what I wanted to hear. During the fall of 2013, Weinstein suggested that I do preliminary research while he decided whether or not to move forward with the project. Between October and December, I interviewed AHF employees and saw the everyday work of HIV prevention and treatment, talked with Weinstein and high-level managers such as Senior Vice President Peter Rees, Global Advocacy Chief Terry Ford, and Chief of Public Affairs and General Counsel Tom Myers, and attended several AHF marketing meetings where domestic and international advocacy campaigns were hashed out. I also went to an AHF protest at the Chinese Consulate General in Los Angeles over China's failure to make significant contributions to the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Visited AHF's Rose Parade float, which generated national headlines and aimed to fight discrimination and stigma by celebrating same-sex marriage, and watched AHF kick off its ambitious 20 by 20 campaign, which challenged world leaders and AIDS organizations to bring 20 million people into HIV treatment by the year 2020, with AHF pledging to care for 1 million of them. To my mind, AHF was relentless and restless in its fight against AIDS, and with good reason. More than 30 years into the epidemic, an estimated 35 million people are living with HIV/AIDS around the globe. Every day, 4,000 individuals die from AIDS-related illnesses. In the U.S., about 50,000 people are newly infected each year, and UNAIDS estimated that between 16,000 and 27,000 Americans died from AIDS in 2012. Worldwide, 2.1 million people are newly infected with HIV annually. Since the early 1980s, according to UNAIDS, 78 million people have contracted HIV/AIDS and 39 million have died from AIDS-related illnesses. There is still no vaccine for human immunodeficiency virus, also known as HIV, which causes acquired immune deficiency syndrome, or AIDS. Since the early 1980s, when HIV was discovered, the transmission of the virus has not changed. According to the Center for Disease Control, CDC, Americans are most often infected by engaging in anal sex, the highest risk sexual behavior, or vaginal sex, by sharing needles, syringes, or other equipment with an HIV-positive injection drug user, or, less commonly, by receiving a blood transfusion contaminated with HIV. Being born to an HIV-positive mother who is not taking HIV medications is another way to be infected by the virus. Having multiple sexual partners or having other sexually transmitted diseases increases the chances of a person getting HIV through sex. These modes of transmission take place in the U.S. and around the world, and vaginal sex or shared needles are the primary ways people are infected in such places as Africa and Eastern Europe. The global problem is now finding people who are HIV positive and getting them on life-saving, highly effective antiretroviral therapy, also known as ART. In 2013, UNAIDS estimated that only 13 million of the world's 35 million HIV/AIDS cases had access to ART, and 19 million were unaware that they were infected with HIV. In the United States, only 37% of the people living with HIV are taking antiretroviral therapy. Treatment is an essential tool to stop the global spread of HIV and AIDS. A landmark study known as HPTN 052, which was published in 2011, found that if a person living with HIV dutifully takes his or her medication, that individual is 96% less likely to infect other people than someone who is not taking medication. So, treatment not only keeps people from dying, but also stops the spread of HIV. Within the global AIDS movement, such a concept is known as treatment as prevention, or T-as-P. The AHF team, which works on the front lines of the worldwide AIDS epidemic, is keenly aware of these statistics and challenges. Sounding a note of urgency that's typical within the organization, Terry Ford told me, "There are 35 million people with HIV, and only 13 million have treatment. So what are we going to do about that? Just let them die? That is not acceptable." By mid-December of 2013, Weinstein gave me the green light. I would dig into AHF's history, but I'd also follow it over the course of 2014, from January 1st to December 31st, and write about what unfolded. AHF would pay me a salary and pick up the tab for my traveling expenses and an assistant. In terms of what I could research or write about, Weinstein placed no restrictions on me. I had always thought highly of Weinstein, but now I was heading into the nitty-gritty. With inside access granted to me for a year, I knew that the truth about AHF would reveal itself, and I had no intention of looking the other way if something scandalous popped up. Too many people had put their lives into its care. If that happened, I wondered if Weinstein would go back on his word about wanting an honest book. I was prepared to quit or be fired rather than betray AHF clients. Whatever played out, I knew I was embarking on an uncharted worldwide journey, and I had no idea what I was going to find. But I had a hunch after the preliminary research. AHF's story could be incredibly inspiring, not just for people combating HIV/AIDS and living with the disease, but for anyone in any country who wants to challenge the status quo and make the world a more just and compassionate and fair place to live. The AHF story, I thought, could be a textbook for the world's aspiring righteous rebels. Chapter 2. The Core of AHF. AIDS Healthcare Foundation is not simply a provider of medical care. Instead, and perhaps more accurately, AHF senior managers consider the organization to be a global movement in which HIV testers, doctors, advocates, and thousands of others in dozens of countries work together to control the spread of HIV/AIDS. It is no small job. AHF's work and influence extends across the United States and around the globe, including such cities as Amsterdam, Moscow, and Mexico City, and rural, remote towns in such countries as Uganda, Cambodia, and Kenya. The global sites reside, for the most part, in 4 AHF bureaus: Africa, Asia, Europe, and Latin America. AHF's headquarters, HQ, however, are not based in traditional power centers such as New York City or Washington, D.C., although it has clinics in both places. The center of the AHF universe is Los Angeles, or more specifically, the neighborhood known as Hollywood. On the corner of Sunset Boulevard and Argyle Avenue, AHF's administrative headquarters is located on the 21st floor of a steel and glass skyscraper called Sunset Media Center. Michael Weinstein works here in a corner office. 3 minutes south of HQ on an industrial stretch of Santa Monica Boulevard, AHF Worldwide operates on the second floor of a green, 2-story building. Global advocacy, domestic and international marketing, and communications departments are housed here. Hollywood Center Studios, where such movies as When Harry Met Sally and The Karate Kid were made, is a next-door neighbor. 4 minutes west of HQ, the Public Health Division resides in a sleek, 2-story building on La Brea Avenue, where AHF's local and national HIV testing, client linkage, and clinic programs are managed. The world-famous Hollywood Walk of Fame is a half-block away. And 4 minutes east of HQ, the Department of Medicine and Research Institute is located in a former bank, 2 blocks from LA's sprawling Griffith Park. The department oversees medical providers at AHF clinics, while the institute conducts research on new ways to treat and prevent HIV/AIDS. The AHF story is very much a Los Angeles story. It is a city in which anyone from anywhere can be
Sample complete. Ready to continue?